The morning sun filtered through the tall windows of St. Mary's Medical Center in downtown Chicago, casting long shadows across the polished white floors. The hospital's emergency room buzzed with its usual Monday morning chaos, ambulance sirens wailing outside, nurses rushing between curtained bays, and the constant beeping of monitors creating a symphony of urgency. Jennifer Patterson, a 32-year-old emergency room nurse with 5 years of experience, stood at the nurses' station reviewing charts. Her perfectly styled blonde hair was pulled back in a tight ponytail, and her navy blue scrubs were immaculately pressed. She prided herself on her appearance and her efficiency, though her colleagues often whispered about her cold demeanor towards certain patients. "Next patient in Bay 7, called out Dr. Marcus Chen, the attending physician, barely looking up from his tablet. Jennifer grabbed the clipboard and walked toward the examination area, her white sneakers squeaking against the linoleum. As she pulled back the curtain, her expression immediately shifted from professional neutrality to barely concealed disdain. Sitting on the examination table was an elderly African-American woman who appeared to be in her late 70s. Her clothes were worn and clearly outdated, a faded floral dress that had seen better days, a thin cardigan with a small hole near the elbow, and scuffed shoes that looked like they'd walked 1,000 miles. Her silver hair was neatly combed but showed signs of being cut at home rather than at a salon. She clutched a small, weathered purse in her lap, and her kind brown eyes looked up hopefully as Jennifer entered. "Name?" Jennifer asked curtly, not making eye contact. "Margaret. Margaret Thompson," the woman replied softly, her voice gentle despite obvious discomfort. "I've been having chest pains for the past 2 days, and—" "Insurance card," Jennifer interrupted, extending her hand impatiently. Margaret fumbled through her purse, her arthritic fingers struggling with the zipper. "I have Medicare, dear. It should be right here." Jennifer sighed loudly, making no attempt to hide her annoyance. She glanced at her watch, then back at Margaret with cold eyes. "Take your time. It's not like we have actual emergencies to deal with," she said sarcastically. Margaret's hands trembled slightly as she finally produced a worn Medicare card. Jennifer snatched it, examined it with a frown, and scanned it into the system. "Chest pains, you said?" Jennifer asked mechanically, typing into the computer without looking at Margaret. "Yes, and some shortness of breath. It gets worse when I—" "On a scale of 1 to 10? Jennifer interrupted again. "Maybe a 7? It's quite uncomfortable, and I was worried because—" "Allergies to medications?" "No, but I wanted to explain that. Previous heart conditions?" Margaret paused, her shoulders sagging slightly at the continuous interruptions. "No, dear. This is new for me. I usually don't come to the hospital unless absolutely necessary." Jennifer finally looked at her, and her expression was unmistakably condescending. "Well, I can see why you'd avoid it. These visits aren't exactly cheap, and Medicare doesn't cover everything." She lowered her voice slightly, but not enough to be private. "You might want to think about whether this is truly an emergency or just something you could handle with over-the-counter medication. The ER is for actual emergencies." Margaret's kind eyes flickered with hurt, but she maintained her dignity. "I understand your concern about costs, but I've been having these pains for 2 days, and I thought it was important to—" "Look," Jennifer said, stepping closer and speaking in a tone one might use with a difficult child, "I see people like you come in here all the time. You probably just have heartburn or anxiety. Do you know how much an ER visit costs? It could be thousands of dollars. Can you afford that?" The words hung in the air like poison. Margaret straightened her spine slightly, her dignity refusing to crumble despite the humiliation. "I appreciate your concern about expenses," Margaret said quietly, "but I believe chest pain warrants medical attention regardless of one's financial situation." Jennifer rolled her eyes. "Of course you do. And then when the bill comes, you'll probably just ignore it or claim you can't pay. That's how it works, right?" She turned back to her computer. "We'll have Dr. Chen see you, but honestly, you're probably wasting everyone's time." At that moment, A young nursing assistant named Carlos Rodriguez passed by the bay. He was a 24-year-old student working his way through nursing school, and he'd overheard part of the exchange. He paused, his expression troubled, and made brief eye contact with Margaret, giving her an apologetic look. Margaret responded with a small, understanding smile that said she'd endured worse in her lifetime. Jennifer noticed the interaction. "Carlos, don't you have actual work to do?" she snapped. "Yes, ma'am," he replied, but not before shooting Jennifer a disapproving glance. Jennifer turned back to Margaret. "I'm going to have you wait here. Dr. Chen will be in when he can, but like I said, we have real emergencies today. A car accident just came in, a child with a severe allergic reaction. You understand. Your heartburn will have to wait." "It's not heartburn," Margaret said softly but firmly. "I know my body, young lady, and something is wrong." Jennifer let out a derisive laugh. "Oh, you're a doctor now? That's wonderful. Maybe you should just diagnose and treat yourself then." She made a note in the chart. "Just sit tight. Try not to touch anything. Everything in here costs money." As Jennifer turned to leave, she nearly collided with Sarah Mitchell, a veteran nurse in her 50s who'd worked at St. Mary's for 25 years. Sarah had silver streaks in her auburn hair and carried herself with the quiet authority of someone who'd seen everything. "Jennifer," Sarah said coolly, "may I speak with you for a moment?" "I'm busy, Sarah." "Now," Sarah insisted, her voice leaving no room for argument. The two nurses stepped away from the bay, though Sarah kept her voice low. "I heard how you spoke to that patient. That was completely inappropriate." Jennifer shrugged. "I was being realistic. She clearly can't afford to be here, and she's probably just." "That's not your decision to make," Sarah interrupted firmly. "Every patient deserves respect and proper care regardless of their appearance or insurance status. That's literally in our code of ethics." "Oh please, Sarah. You've been here long enough to know how it works. These people come in for every little thing, run up huge bills they never pay, and the rest of us have to deal with the consequences. I was trying to save her from receiving medical care?" Sarah's eyes flashed with anger. "Listen to yourself. Your job is to assess, treat, and care for patients, not to judge their financial situation or decide who deserves help." Jennifer crossed her arms defensively. "I'm just being practical. Someone has to be." "No, you're being cruel," Sarah said bluntly. "And if I hear you speak to another patient that way, I'll be reporting it to the nursing supervisor. Are we clear?" Before Jennifer could respond, Dr. Chen's voice called out, "Jennifer, I need you in Bay 3. We have a situation." Jennifer shot Sarah an annoyed look and hurried away. Sarah shook her head, took a deep breath, and walked back to Margaret's bay. "Mrs. Thompson," Sarah said warmly, pulling back the curtain with a genuine smile. "I'm Sarah, one of the nurses here. I'm so sorry for how you were treated. That was unacceptable." Margaret's eyes softened with gratitude. "Thank you, dear. I appreciate that more than you know. Let me take your vitals properly and get Dr. Chen in here right away," Sarah said, pulling out her stethoscope. "Tell me about these chest pains. When did they start?" As Sarah carefully and respectfully examined Margaret, the elderly woman felt tears prick her eyes, not from the pain or the earlier humiliation, but from the simple kindness of being treated like a human being. "You know," Margaret said softly as Sarah checked her blood pressure, "I've been coming to this hospital for a very long time. In fact, I have quite a history with St. Mary's." "Oh," Sarah said, genuinely interested as she noted the reading, 148/92, slightly elevated. "Yes," Margaret continued, a small mysterious smile playing at her lips. "A very long history indeed." Outside the bay, the hospital continued its frantic pace. Ambulances arrived, patients were admitted, and Jennifer Patterson continued her shift, completely unaware that the woman she'd just humiliated was about to change everything. In her worn dress and scuffed shoes, Margaret Thompson sat quietly, her secret safely kept. For now. The morning sun continued to stream through the windows, and the hospital hummed with life, standing as it had for 40 years, a monument to healing, hope, and humanity. Though at this moment, it seemed to have forgotten the last part. Chapter 2. The Investigation. 3 days after Margaret's visit to the emergency room, she sat in her modest apartment on the south side of Chicago, staring out the window at the autumn leaves swirling in the wind. The chest pains had subsided after Dr. Chen had properly examined her. It had been angina, a warning sign that Sarah's intervention had likely saved her from something worse. She'd been prescribed medication and ordered to follow up with a cardiologist. But the physical pain had faded far more quickly than the emotional wound Jennifer's words had inflicted. Margaret's apartment was small but immaculately kept. The furniture was old but well-maintained, each piece holding decades of memories. Framed photographs lined the walls, black and white images from the 1960s, faded color pictures from the 70s and 80s, and more recent digital prints. One photograph, prominently displayed on the mantel, showed a younger Margaret in a business suit standing in front of a building under construction. A hard hat perched on her head and a brilliant smile on her face. The building in the photo was St. Mary's Medical Center. Margaret picked up her telephone, an old landline she'd never bothered to replace, and dialed a number she knew by heart. Reynolds Legal Group, how may I direct your call? Came a professional voice. Thomas Reynolds, please. Tell him it's Margaret Thompson. There was a brief pause, then the voice became notably warmer. Mrs. Thompson. Of course, let me put you through immediately. Within seconds, a deep, warm voice came on the line. Margaret. What a wonderful surprise. How are you feeling? I heard about your hospital visit. Thomas Reynolds was a distinguished African-American attorney in his early 60s who'd been Margaret's lawyer for over 30 years. He'd started his career with a small practice and had grown it into one of Chicago's most respected legal firms, specializing in healthcare law and corporate governance. I'm well, Thomas. Thank you. The medication is helping, Margaret said. But I'm not calling about my health. I need you to do something for me. Thomas's tone shifted slightly, sensing the seriousness in her voice. Of course. What do you need? I want you to conduct a thorough investigation of the current operations at St. Mary's Medical Center. Specifically, I want to know about the emergency department, patient treatment protocols, staff conduct, any complaints filed, patient satisfaction scores, everything. There was a long pause on the other end of the line. Margaret, Thomas said carefully, you haven't intervened in the hospital's operations in almost 15 years. You set up the trust, established the board, and stepped back. What's happened? Margaret took a deep breath and recounted her experience with Jennifer Patterson, the dismissive attitude, the humiliating comments about her financial situation, the assumption that she was wasting everyone's time. When she finished, Thomas was silent for a moment. Then he spoke, his voice tight with controlled anger. That's absolutely unacceptable. I'll start the investigation immediately. You know I'll need to be discreet, though. If we're going to address this properly, we need documentation. I understand, Margaret said. I don't want revenge, Thomas. I want to know if this was an isolated incident or if there's a systemic problem. If I suffered that treatment, how many others have? How many people have avoided seeking necessary medical care because they were afraid of being judged or humiliated? I'll handle it personally, Thomas assured her. Give me 2 weeks. I'll hire private investigators to pose as patients, review complaint records, interview staff anonymously. We'll get a complete picture. Thank you, Thomas. Margaret paused, her voice softening. You know, when I built that hospital, I had a vision. A place where everyone would be treated with dignity, regardless of their race, their income, their background. My parents couldn't get proper medical care in the 1940s because of the color of their skin. When I had the means to change that, I did. I know, Margaret. And St. Mary's has done incredible work over the years. It's helped hundreds of thousands of people. But if that mission has been compromised, we need to address it. After hanging up with Thomas, Margaret walked to her window and looked out at the Chicago skyline in the distance. She could just barely see the top of St. Mary's Medical Center, its modern glass and steel addition glinting in the afternoon sun. Meanwhile, at St. Mary's Medical Center *, Jennifer Patterson sat in the staff break room, scrolling through her phone while eating a salad. Her colleague, another nurse named Brittany Chen, sat across from her complaining about a difficult patient. "I swear, they come in here expecting 5-star hotel service," Brittany said, rolling her eyes. "This guy demanded extra pillows, wanted his room temperature adjusted 3 times, asked for specific types of juice. I mean, this is a hospital, not the Ritz-Carlton." Jennifer laughed. "Tell me about it. Last week I had this old woman come in claiming chest pains. She was dressed like she'd been shopping at a thrift store from 1995. I tried to save her the embarrassment of a huge ER bill, and she acted all offended." Sarah Mitchell, who'd been reading a book in the corner, looked up sharply. "Are you talking about Mrs. Thompson?" Jennifer glanced over dismissively. "I don't remember her name. Just another Medicare patient who probably should have gone to an urgent care clinic." "You don't get to make that call," Sarah said firmly, closing her book. "That's not your job, Jennifer." "Oh, here we go again," Jennifer said, her tone mocking. "Saint Sarah, defender of all patients, no matter how inappropriate their use of emergency services." "It's called compassion," Sarah shot back. "Maybe you've heard of it? It's kind of a crucial part of nursing." Brittany jumped in, trying to lighten the mood. "Come on, guys. We're all stressed. Let's not fight." But Sarah wasn't finished. She stood up, gathering her things. "You know what the real problem is? Nurses like you give the rest of us a bad name. You think because someone doesn't look wealthy or doesn't speak up for themselves, they don't deserve the same care as everyone else. That's not medicine. That's discrimination." Jennifer scoffed. "Discrimination? That's a bit dramatic, don't you think? I'm just being realistic about hospital resources and—" "You were being cruel," Sarah interrupted. "And what's worse is you don't even see it." She walked toward the door, then paused. "You better hope that woman doesn't file a complaint. Because if she does, your realistic approach to patient care is going to become a real problem for your career." After Sarah left, Jennifer turned to Brittany. "She's so dramatic. Like I did something terrible." Brittany looked uncomfortable. "I mean, maybe she has a point. I wasn't there, but from what you described, it does sound kind of harsh." "Whose side are you on?" Jennifer demanded. "I'm just saying, maybe we should all try to be a little more, I don't know, understanding." Jennifer stood up abruptly, throwing away her half-eaten salad. "Whatever. I have patients to see. Real emergencies, not people looking for sympathy." 2 weeks later *. Thomas Reynolds sat in his office reviewing the investigation reports. He'd spread dozens of documents across his large oak desk: patient satisfaction surveys, recorded complaints, staff interview transcripts, and surveillance footage from the emergency department. His assistant, Monica, a sharp young woman who'd graduated top of her class from Northwestern Law, sat across from him, her tablet showing graphs and statistics. "The data is troubling," Monica said, highlighting a chart. "Patient satisfaction scores in the emergency department have dropped 22% over the past 18 months. Complaints regarding staff rudeness have increased by 34% during the same period." Thomas flipped through witness statements. "And these accounts from the investigators we sent in?" 3 of our 5 investigators reported experiencing or witnessing dismissive treatment from ER staff. 2 specifically mentioned a nurse named Jennifer Patterson. 1 investigator, who went in with appropriate insurance and well-dressed, received exemplary care. The other 2, who presented as lower-income patients, were treated markedly differently. Longer wait times despite similar conditions, more rushed examinations, and notably less friendly interactions. Thomas rubbed his temples. "This is exactly what Margaret experienced. What about the historical data? Monica swiped to another screen. Interesting pattern. 5 years ago, the ER had a 91% patient satisfaction rating. It's now down to 69%. The decline correlates with staff turnover in nursing supervisory positions and the hiring of several nurses who came from facilities with documented patient care issues. Does Jennifer Patterson have any complaints in her file? Officially, no. But Monica pulled up another document. We found several informal complaints logged by other staff members with their supervisors. Concerns about her treatment of uninsured or lower-income patients. But none were formally investigated or addressed. Thomas leaned back in his chair, anger simmering beneath his professional exterior. So there's a pattern of behavior that's been observed, reported, and ignored. It appears so. The supervising staff either didn't take the concerns seriously or didn't want to deal with the HR process involved in formal documentation. What about the current hospital administration? Who's in charge? David Mitchell is the hospital administrator. He's been in the position for 3 years. Before that, he worked at several for-profit hospital chains. His management style appears to be heavily focused on efficiency metrics and budget management rather than patient care quality. Thomas made a note. And the board of trustees? 15 members, all appointed per the terms of Mrs. Thompson's trust. They meet quarterly. We pulled the minutes from the last year of meetings. Most discussions centered on financial performance, capital improvements, and operational budgets. Patient care quality metrics were mentioned but not thoroughly reviewed. Thomas was quiet for a long moment, processing the information. Then he picked up his phone. Margaret, it's Thomas. Can you come to my office tomorrow afternoon? I have the investigation results, and we need to discuss them. The next day, Margaret sat in Thomas's office, reading through the reports with reading glasses perched on her nose. She read slowly, carefully, occasionally pausing to reread a section or study a particular statistic. When she finally looked up, her expression was a mixture of sadness and determination. This isn't the hospital I built, she said quietly. No, Thomas agreed. It's not. I created St. Mary's to be different. To be a place where your income didn't determine the quality of your care, where your race or background didn't affect how you were treated. Her voice grew stronger. My father died of a treatable condition because no hospital would admit him in 1948. I was 10 years old. Do you know what that does to a child, Thomas? Watching your father suffer, knowing he could be saved, but the color of his skin meant more than his life. Thomas nodded solemnly. He knew Margaret's story well. How she'd worked her way through college, became a successful businesswoman in real estate development, and eventually made her fortune. And how she'd poured millions into creating St. Mary's Medical Center with the explicit mission of providing excellent healthcare to everyone, especially underserved communities. You honored that mission for decades, Thomas said. But something has changed. The culture has shifted. Margaret set down the reports. What are my options? Thomas had been preparing for this question. Well, legally, you still own the hospital through the charitable trust. You established the board, but the trust documents give you ultimate authority as founder and benefactor. You've chosen not to exercise that authority, allowing the board to manage operations independently. That was by design, Margaret said. I didn't want St. Mary's to be about my ego. I wanted it to be an institution that would outlast me. And it will, Thomas assured her. But right now, it needs course correction. You have several options. 1. You could file a formal complaint about Jennifer Patterson's conduct and let the hospital's internal disciplinary process handle it. What are the chances that would result in meaningful change? Given what we've found about the administration's response to previous concerns? Low. They'd probably give her a written warning, make her attend some sensitivity training, and move on. Next option. 2. You could call an emergency meeting of the Board of Trustees, present these findings, and demand they address the systemic issues we've uncovered. Force them to implement new policies, increase oversight, and possibly replace the hospital administrator. That might work, Margaret said thoughtfully. But it's indirect. I'd be relying on the board to follow through. Which brings me to option 3, Thomas said, leaning forward. You could reveal your identity to the hospital staff and administration, and directly oversee a complete reform of the emergency department and patient care protocols. It would be dramatic, but it would send a clear message. Margaret was quiet for a long time, her eyes distant. When I stepped back from the hospital's operations, she finally said, I thought I was doing the right thing. Letting others run it, staying out of the way. I lived modestly, kept my connection to St. Mary's private, and watched from a distance as it grew and served the community. You did do the right thing, Thomas said gently. But circumstances change. Sometimes the founder needs to return. Margaret stood and walked to the window, looking out at the city she loved. That young nurse, Jennifer, she said quietly. She saw an old black woman in worn clothes and assumed she knew everything about me. She assumed I was poor, that I didn't matter, that I was a burden on the system. She never bothered to see me as a person with a lifetime of experiences, contributions, and dignity. She turned back to Thomas. How many others has she treated that way? How many people have left St. Mary's feeling humiliated and small? How many decided not to come back, even when they needed help? Too many, Thomas said. That's what the data shows. Margaret nodded slowly, her decision crystallizing. Schedule a meeting with the Board of Trustees for next week. All members must attend, no exceptions. And Thomas, don't tell them what it's about. Just say there's an urgent matter regarding the hospital's future. What are you planning? A small smile crossed Margaret's face, not a happy smile, but one of firm resolve. I'm planning to remind St. Mary's Medical Center what it was created to be, she said. And I'm going to make sure everyone, from the board to the janitorial staff, understands that dignity and compassion aren't optional values. They're the foundation. Thomas returned her smile. Should I inform the hospital administrator about the meeting? Yes. Tell David Mitchell that the hospital's benefactor wishes to address the board. I think it's time he and I had a conversation about what efficient operations really means in a healthcare setting. And Jennifer Patterson? Margaret's expression became serious. She'll be at the meeting too. Along with Sarah Mitchell, the nurse who showed me kindness. And that young nursing assistant, Carlos Rodriguez. I want them to understand what happens when you treat people with dignity versus when you don't. As Margaret left Thomas's office that afternoon, the wheels were set in motion. In 7 days, everything at St. Mary's Medical Center would change. The question was, would the change come too late for some? Or would it mark a new chapter in the hospital's mission of compassionate care? Only time would tell. Chapter 3. The Revelation. The boardroom of St. Mary's Medical Center was located on the top floor of the original building, a space that had been designed 40 years ago with care and intention. Large windows overlooked the Chicago skyline, and the walls were adorned with historical photographs documenting the hospital's construction and early years. A long mahogany table dominated the room, surrounded by high-backed leather chairs. David Mitchell, the hospital administrator, paced nervously near the windows. He was a tall man in his early 50s with salt and pepper hair and an expensive navy suit. His 15 years of experience managing hospitals had taught him to read situations, and something about this emergency board meeting felt ominous. Has anyone heard from the benefactor before? Asked Dr. Patricia Okonkwo, the chief of surgery and one of the board's most respected members. She was a Nigerian-American woman in her late 40s who trained at Johns Hopkins and had been with St. Mary's for 12 years. Not in my 3 years here, David admitted. The trust sends its financial contributions like clockwork, but there's never been any direct contact. Everything goes through the legal firm, Reynolds Legal Group. I've been on this board for 8 years, added Robert Fitzgerald, a silver-haired retired banker who served as the board's treasurer. The benefactor has never requested a meeting in all that time. This is unprecedented. The boardroom door opened, and Thomas Reynolds entered, his briefcase in hand and his expression professional but grave. Behind him came Monica, carrying a laptop and several file boxes. "Good afternoon, everyone," Thomas said, moving to the head of the table. "Thank you all for coming on short notice. I understand this is unusual, but I assure you the matter is of critical importance." The 15 board members settled into their seats, exchanging curious glances. Also present were David Mitchell, the nursing supervisor Elena Vasquez, the chief medical officer Dr. Harrison James, and the hospital's legal counsel, an older white man named Stuart Whitmore. Thomas remained standing. "Before we begin, I need to bring several staff members into the room. They'll be joining us for this meeting." David frowned. "Staff members? Thomas, board meetings are typically closed sessions. What's this about? You'll understand shortly. Monica, would you?" Monica opened the door, and 3 people entered. Sarah Mitchell, the veteran nurse, looking confused but composed. Carlos Rodriguez, the young nursing assistant, visibly nervous in his hospital scrubs. And Jennifer Patterson, whose face showed annoyance at being pulled from her shift without explanation. "What's going on?" Jennifer demanded. "I was in the middle of—" "Please sit down, Ms. Patterson," Thomas said firmly. "All of you, please take seats along the wall." The 3 staff members sat in chairs arranged against the side of the room. Sarah and Carlos exchanged puzzled looks, while Jennifer crossed her arms defensively. Thomas checked his watch. "We're waiting for one more person. The individual who requested this meeting." "The benefactor?" Dr. Okonkwo asked. "Yes." The room fell into an uncomfortable silence. The board members whispered among themselves, speculation running wild about who this mysterious benefactor might be. Some had assumed it was a wealthy Chicago family who wished to remain anonymous. Others thought perhaps it was a corporate foundation or trust fund established by someone long deceased. Then the door opened again. Margaret Thompson entered the boardroom. She wore a simple but elegant navy dress, modest pearl earrings, and low-heeled shoes. Her silver hair was neatly styled, and she carried herself with quiet dignity. She looked exactly as she had in the emergency room, an elderly black woman who anyone might pass on the street without a second glance. Jennifer's mouth fell open in shock. Sarah's eyes widened with sudden understanding. Carlos sat up straighter, sensing something momentous was about to happen. "Who is this?" David Mitchell asked, confusion evident in his voice. Thomas gestured toward Margaret with unmistakable respect. "Ladies and gentlemen, may I introduce Mrs. Margaret Thompson, founder and benefactor of St. Mary's Medical Center." The room erupted in shocked murmurs. Board members turned to each other in disbelief. David Mitchell's face went pale. Elena Vasquez, the nursing supervisor, looked like she might faint. Jennifer Patterson sat frozen, the blood draining from her face as the full weight of realization crashed over her. Margaret walked slowly to the head of the table, standing beside Thomas. She surveyed the room with calm, intelligent eyes, letting the moment settle before she spoke. "Good afternoon," she said, her voice clear and strong despite her age. "I apologize for the mysterious nature of this meeting, but I felt it was necessary." "Mrs. Thompson," Dr. Okonkwo said, recovering from her shock and standing respectfully, "it's an honor to meet you. I had no idea. None of us did." "That was by design," Margaret said gently. "Please, sit. We have much to discuss." She waited until everyone was seated, then began. 42 years ago, I broke ground on this hospital. I was 53 years old, and I'd spent the previous 30 years building a real estate development company from nothing. I'd grown up poor on the south side of Chicago, the daughter of factory workers who couldn't afford proper health care. When my father died of pneumonia that could have been treated with antibiotics, I made a promise to myself. If I ever had the means, I would create a place where everyone could receive excellent medical care, regardless of their ability to pay. She paused, her eyes distant with memory. St. Mary's Medical Center was that promise fulfilled. I poured $20 million of my own money into its construction. Money I'd earned through hard work, smart investments, and yes, some luck. But I didn't build this hospital as a monument to myself. I built it as a sanctuary for healing, where the content of one's character and the urgency of one's medical need would be the only factors determining their care. Margaret walked slowly around the table as she spoke, and every eye in the room followed her. I established a charitable trust to fund the hospital's operations and set up this board to ensure professional management. I deliberately stayed in the background because I didn't want St. Mary's to be about me. I wanted it to be an institution that would serve this community long after I was gone. She stopped near the windows, looking out at the sprawling medical center complex, buildings and wings that hadn't existed when she first broke ground. For decades, I watched from a distance as St. Mary's grew and flourished. I read every annual report. I reviewed every financial statement. I tracked patient outcomes and community impact. And I was proud. So very proud of what this hospital became. Her voice hardened slightly. But then, 2 weeks ago, I came to the emergency room. I was experiencing chest pains, angina, as it turned out, and I was frightened. I dressed in my everyday clothes, took the bus to the hospital, and walked into the ER seeking help. Margaret turned back to face the room, her gaze settling on Jennifer Patterson. And I was treated with contempt. Jennifer seemed to shrink in her chair. I was judged based on my appearance and my insurance. I was mocked for seeking care. I was told I was wasting valuable hospital resources. I was made to feel small, worthless, and ashamed for having the audacity to believe my health mattered. The room was deathly silent. "Ms. Patterson," Margaret said, addressing Jennifer directly, "do you remember me now?" Jennifer's voice came out as a whisper. "Yes, ma'am. What did you say to me that day? Please remind everyone in this room." Jennifer's eyes filled with tears, but Margaret's expression remained firm. I said that the ER was for actual emergencies. I suggested you might be wasting everyone's time. I questioned whether you could afford the visit. Her voice broke. I was disrespectful and dismissive. "You were cruel," Margaret said simply. "You saw an elderly black woman in worn clothes and assumed you knew everything about me. You never asked about my medical history. You never inquired about my symptoms in detail. You never treated me like a human being worthy of dignity and respect." Sarah Mitchell spoke up, her voice tentative but clear. "Mrs. Thompson, I want to apologize on behalf of the nursing staff. What you experienced was absolutely unacceptable. I tried to intervene when I overheard." Margaret turned to Sarah with a warm smile. "Ms. Mitchell, you have nothing to apologize for. You were the one who treated me with compassion. You listened to my concerns, you examined me properly, and you made sure Dr. Chen saw me promptly. Your care may have saved my life." Sarah's eyes glistened with emotion. Margaret then looked at Carlos. "And you, young man? You were just passing by, but you gave me a kind look when I needed it most. Small gestures of humanity matter more than you know." Carlos nodded, too overwhelmed to speak. Margaret returned her attention to the full room. "I didn't come here today for revenge or to publicly shame anyone. I came because my experience made me wonder, if the founder of this hospital can be treated with such disrespect, what happens to everyone else? What happens to the truly vulnerable people who don't have resources or connections?" Thomas stepped forward and began distributing copies of the investigation report to the board members. "What you're receiving," he explained, "is a comprehensive investigation into patient care practices at St. Mary's Medical Center, with particular focus on the emergency department. The findings are troubling." As the board members flipped through the reports, their expressions grew increasingly concerned. Dr. Okonkwo read aloud from one section, "Patient satisfaction scores have declined 22% over 18 months. Complaints regarding staff rudeness have increased by 34%. Multiple informal complaints about discriminatory treatment based on appearance and insurance status have been logged but not formally investigated. David Mitchell looked like he wanted to sink through the floor. Mrs. Thompson, I had no idea the situation had deteriorated to this extent. I've been focused on operational efficiency and budget management, but clearly I've missed. You've missed the heart of what this hospital is supposed to be, Margaret said, not unkindly but firmly. Operational efficiency doesn't mean anything if we're not providing compassionate, dignified care to every person who walks through our doors. Elena Vasquez, the nursing supervisor, spoke up. Mrs. Thompson, I've received informal complaints about certain staff members, including Ms. Patterson, but I didn't follow proper protocols for documentation and investigation. That's my failure, and I take full responsibility. Why didn't you follow?